National Women's Health and Fitness Day, which is officially this Saturday. We wanted to talk about some of the major health issues women are facing, and here to answer all of our questions, or at least some of them, is our resident doctor, Dr. Dave. He is in the house.
Hey,
Dr. Dave. Good to have you back.
To see you
on our
It's heart disease,
Yeah,
Dr.
it can
Dave.
be, yeah.
And we love when you come to the circle because you do so well in expounding on all of the elements that we need to pay attention to when it pertains to heart disease.
Yeah.
So one of the questions that I have is, you know, we think of heart disease, we think of working out to combat obesity.
Yeah.
Is that one of the things that's going to keep it at bay? And if so, and let's say you still have to be on heart medication, is all heart disease medication safe?
Yeah, so that's a whole segment right there, what you just talked about. But here's what I'll say. We should be continuing to talk about heart disease.
Yes.
You know, some people say, you know, why do you always talk about heart disease when you get on there? You know, we heard about that before. And you know, I'll say, okay, I'll stop. I'll stop talking about heart disease as soon as women stop dying needlessly of heart disease. Then I'll stop, right? You know, one of the major drivers in African American women that keeps them at the top of the list of people who die from heart disease is obesity, this metabolic syndrome we call it. I call it the muffin top syndrome.
Top.
You think that's cute? That's not cute.
You think that's cute? I can't.
because what's really happening inside the body, not you per se, but you know, people think that you know, that used to be a thing.
Yeah.
You've got all of this stuff happening in your body that's eroding your blood vessels, and when it erodes your blood vessels 10, 15 years down the line, you're not thinking about that muffin top when you're in the ER, can't move an arm or having a heart attack. The message is not as scary when the message is it's still 85% preventable, but how are you going to prevent it if you don't know you have it? Right? When women stop saying, oh, no, I don't have a family history of heart disease, I'm good. When we stop saying that, when we stop saying because I don't feel anything, I don't have heart disease, then you'll stop hearing Dr. Dave talk about heart disease, okay?
What are the big C cancer, the three main cancers that women need to look out for?
Yeah, so you know, cancer screening really is a big deal, just like heart screening, because early detection, Quad, and they're afraid. They're afraid of what the consequences might be, and here's the deal.
So it's like breast cancer, ovarian cancer, cervical cancer,
That's
lung
exactly right.
cancer.
Thanks for bringing me right back on into this. So either breast cancer, cervical cancer,
ovarian,
and ovarian cancer. These
cancer.
are all, if you have any of those organs, you should get them checked. There is no, hey, it's not in my family. Absolutely.
Okay.
Well, we all know that smoking and drinking is a big issue in the community, but let's get back to this whole lung cancer thing. Because this whole vaping phenomenon is just like overtaking the airwaves. So tell us about some concerns we need to have with this.
I'm trying to figure out how to answer that without getting the FCC on our case. Can have heart disease, cancer, and lung disease from it. So we want people to stop doing all of that.
So why do you think it's such a focal point right now for vaping? Because people have been hookahing for a really long time.
They have, but it's enjoyed a resurgence, just like cigars. You know, there's more women at cigar bars nowadays than men. And it's just cool now. Marketing is amazing, right? It's like the, you know, Popeye's chicken sandwich. Marketing is amazing.
Wait a minute, the Popeye's chicken.
So you talked about you know, being in so many different directions, taking care of other people, but women, I mean, we all, I think, have experienced some type of anxiety and depression. So let's talk about that when it comes to women and us taking on everybody else's stuff and our own as well.
And that's one of the main reasons, right? And we don't talk about that stuff. Right? There's a woman sitting next to you right now who might be having anxiety or depression. Here's what a psychiatrist told me. We don't ask. We don't ask. Isn't it heartbreaking when somebody takes their own life? We don't ask how are you doing? Really, sincerely, how are you doing?
Right.
And if we would just ask and get to help, a lot of that stuff is treatable. A lot of it is treatable.
See you today at 12 o'clock, Dr. Joy.
I know that's right about
it. I love it.
Come on.
I love it.
Yes.
So I want to talk a little bit about my fibroids that I don't have anymore.
Amen.
But, you know, I
I
started my own journey with fibroids, and I had the surgery accessive procedure back in March. Let's talk a little bit about why is it that African American women are so disproportionately diagnosed.
Yeah.
Why is that?
So it's not really clear why women of color, especially women of African descent, develop so many of these fibroids. Fibroids are little benign tumors that develop in the uterus. Some of them can be very, very large, and they affect fertility. They, I have women in my clinic whose blood levels are so low because their cycles are so heavy and so prolonged, and many of them just don't want. They're of the mindset, if I was born with it, I don't want to lose it. But you also don't want to just pass out and never wake up because your blood levels are so low.
And
so
that can
what
happen.
you did, absolutely, it has happened. What you did cannot be understated as one of the most courageous things, and I really commend you and applaud you for that. And people should really take a take a page from you.
My goodness, my goodness. Well, what is this coming down the line
well,
here?
you know what I thought? I thought that since you guys brighten up so many lives and you're a breath of fresh air, I thought I could bring some nice bright flowers with a nice fragrant scent to say congratulations. You guys really impact so many lives. Happy season 3. Many more to come, but this one's the best one yet.
How about it? Thank you so much, Dr.